This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
Good morning. We're going to do a quick medical minute on the treatment of pneumothoraces. So this is a paper that came out of the New England Journal of Medicine in January 2020. It was a multi-center randomized trial conducted in the United Kingdom, and it was a non-inferiority trial. So a non-inferiority trial means that you're basically taking a treatment and comparing it to a known existing treatment and to see if it's either no better or it could be worse, could be better. But you're basically trying to make sure the new treatment isn't worse. And so they were looking at people who had a first known unilateral spontaneous pneumothorax. A lot of people we see in the emergency department present like that, ages 14 to 50, and it had to be a moderate to large pneumothorax, so greater than 32% as measured on X-ray. So they had half the people, about 150 or so, in this immediate intervention. So that's what we usually do, which is put a chest tube in. And then the other half of the people were conservative, meaning nothing. They were watched in the emergency department for 4 hours, had a repeat chest X-ray. If it looked no worse, if they weren't in significant pain, if they weren't having difficulty breathing, they weren't hypoxic, they would actually go home. Now, the interesting thing about this trial is that they had amazing follow-up. So they had follow-up at 24 hours in person, 72 hours in person, 2 weeks and 4 weeks and 8 weeks in person. And then they had follow-up by phone at 6 months and 12 months. The primary outcome was looking at resolution of the pneumothorax within 8 weeks. So if you did an X-ray and the radiologist read it as back to normal, then you were a success story. So in the conservative group, meaning no chest tube put in, only 15% of those people actually required a chest tube or some other intervention. So 85% of the people never required anything. At 8 weeks, so again, our primary point, in the conservative group, 98.5% of people had resolution of the pneumothorax, versus the intervention group had 94.4%. Now, you have to look at the data a little more carefully here, because you also have to include those people who weren't able to be followed up, like they disappeared, they never showed up. If you count those people as a treatment failure, the numbers aren't quite as good. So you have to take this data with a grain of salt, but by looking at that 8 week, the people who had follow-up, it was clearly not inferior to have no chest tube or no intervention at that time. So the median time to X-ray resolution was 16 days in the intervention group. It was 30 days in the conservative group. So it took longer to improve on an X-ray, but still 98% did have resolution. Symptom resolution by 8 weeks, 93% in the intervention group and 94% in the conservative group. And the median time was about the same, 15 days and 14 days. The recurrence during the 12 months was low in both groups. It was 17% in the intervention group, only 8% in the conservative group. And then adverse events, 41 adverse events in the intervention group and only 13 in the conservative group, which makes sense because you're not doing anything to these people, so they don't have anything to have an adverse event from. Now, 15% of them did ultimately require a chest tube. So in the United States at this moment, it would not be standard of care to send that patient if they walked into the emergency department home today. But, this data is pretty compelling. We probably need another study to confirm it, make sure that it's actually validated in another cohort of patients. But there may be a time where we see that patient who comes in with a large or moderate spontaneous pneumothorax, and we observe them and make sure they have good follow-up. Follow-up is really the key here. We can't send these patients home and just, wish them the best. They really need follow-up. And this follow-up was exceptional because it was in person so often. But we may have clinics where we can get them follow-up, so there may be a time where we can actually let these folks go home without having to put a scalpel and a big tube in their chest.
The Emergency Medical Minute would like to thank our sponsor, Swedish Medical Center, for helping fund our nonprofit organization and make this podcast possible. Donations are essential to our organization to cover operational costs and fund the creation of our online courses offering AMA PRA Category 1 credits. So if you enjoy our show, and if you're able to make a one-time or recurring donation towards our organization, any amount is helpful. Please click the link in our show notes to make a donation. Thank you for listening.